Ceann Comhairle. There are a number of points I'd like to make with respect to the winter plan. First of all, I'd like to welcome the additional funding across a number of areas. I think the reality is that this must, out of necessity, be a dynamic process, as it is responding to a situation that is changing almost daily. However, there are a number of challenges that come with that uncertainty and the need to respond quickly. I would like to draw your attention to those requiring services on a long-standing basis who have found the last number of months incredibly difficult. It is very encouraging that extra funds for homeless supports have been included in the measures. This is an issue that impacts the whole country, of course, but is keenly felt in my own constituency. Services were already under pressure from increased numbers in 2019. Dublin Simon community saw an 18% increase in demand for homeless healthcare services last year and provided access to treatment for more than 1,200 people. There was also an increase in waiting times for access to related services over the previous year. For example, for access to detox services, the wait time increased by 84%. The same organisation has now also warned of a health crisis among the homeless population in the capital due to the pressure on funding and a shortage of suitable accommodation. COVID has brought the entire system for homelessness and addiction supports to the very brink of capacity. I am aware in my own constituency that the constraints of the pandemic means that many service providers need additional space. They need more sanitation facilities particularly. A lack of facilities has not only impacted the people who need this most basic human right, but it also has a knock-on impact in the local community as service providers kind of spill out. So I would urge the Minister to consider capital funding and confirmed multi-annual funding for the provision or lease of buildings to those groups to accommodate the increase in need, along with the constraints that COVID represents in terms of delivering those services. Similarly, I very much welcome the inclusion of considerable funding for home care, for community health networks and for the GP diagnostics. I am very aware, though, that COVID has put immense pressure on people's mental health and has had a huge impact on persons with disabilities and their families. And I would urge the Minister to consider the long-term impact on poor mental health and a lack of disability services within the community, and bear this in mind when making decisions around the budget in the next few days, as honestly the sector does need far more than has been announced or included in the winter plan. Secondly, I would like to draw the Minister's attention to the report this week from the Parliamentary Budget Office on expenditure undertaken this year and their concerns around transparency and accountability. Again, I am aware from my own constituency that private hospitals in many cases provided absolutely vital capacity to the public sector during the COVID-19 crisis, and they facilitated the continuation of care in other medical specialities, and this was really, really important and worthwhile. However, the winter plan document outlines that almost 10% of the total winter plan spend of £604 million is going to go to private hospitals. There is, however, scant detail provided on what we were getting for this. Other than that, some of it will be used for elective procedures. Not in itself a bad idea if it increases capacity in public hospitals, but again, we don't really have enough detail. None of it is being used for surge capacity, and that this would need to be provided separately. If we are going to spend taxpayers' money with private hospital operators, I believe that we do need to be clear right now on what exactly we are getting for the amount that we are spending and what outcomes we are expecting as a result of that spend. And finally, I would like to say this: COVID has changed us and has changed our communities irrevocably. And no winter plan will paper over the cracks of a system that needs reform. So the pandemic has been a shock and awe event for our health service, really. The leadership of clinicians and frontline staff has never been more meaningful or more impactful. And the reality is that our health service for years has focused on servicing the needs of organisations, not always the needs of patients. And COVID has allowed us to cut through some of that. We need Sláintecare. We should seize this moment. We need it now. So let's allow our time of adversity to also be our moment of clarity. Let's begin the active implementation of Sláintecare. Let's give ourselves a deadline. I think spring 2023. That's 30 months. Let's be ambitious, because the NHS in the United Kingdom was established in 1948 at a time when their public finances were in total disarray, and the future seemed incredibly challenging and very uncertain. And I think that sounds very familiar to all of us right now. But they pushed forward towards their vision of universal healthcare for everybody, and I think we should push forward with ours.